restricting access to alcohol could help ease the burden on hospitals, certainly, but that doesn't mean a full ban is being considered. Let's look at possible options for alcohol control with Professor Charles Parry. He's the Director of the Alcohol, Tobacco and Other Drug Research Unit at the SA Medical Research Council. Prof, always great to chat to you. So, am I correct that while a full ban seems to have an immediate impact on the pressure on our hospitals, less drunk driving, less fights, it's absolutely not on the cards this time round?
No, I don't believe so. From documents I've seen, certainly they're talking about sort of a more focused approach on hotspot areas. And the one proposal that's been in the media is a sort of for those hotspot areas you talked about in Nelson Mandela Bay or in the Garden Route, and we'll find out very soon, talking about a 10 p.m. curfew. And when you look at alcohol, restricting on-consumption sales to 9 o'clock and off-consumption, go back to the Monday to Thursday idea. And then obviously limiting number of people indoors to 100 maximum, 250 outside, and banning these after-tears events. But the rest of the country supposedly would be on level 1. My own thinking is there's a lot of common sense in that, but probably these things should have been implemented, for example, in Nelson Mandela Bay Metro a couple of weeks ago, because we heard about what was going on there about 3 weeks ago. And I think we needed a much more proactive approach rather than perhaps even now that's too little too late in those areas, in fact, to get a real a tangible effect on reducing cases, the rising of cases and the burden on hospitals.
It certainly seems like we're looking at a more targeted approach, and I suppose this goes hand in hand with the fact that we've now got much quicker testing turnaround and we're better at tracing, so we know where the cluster outbreaks are. So that makes sense in terms of the curfews that you're saying. In those tricky areas, the curfew will come in earlier so that people won't be out as long, and that will hopefully curtail alcohol use and abuse. But how would an area-specific alcohol sales restriction work? Let's say you go back to the Monday to Thursday. Surely you can just ship your alcohol in on the Friday. I don't see the sense in making it a 4-day sale option in a hotspot area, but a 7-day option everywhere else.
Yes, I mean, it depends on what the size of the area that's sort of blocked down. Obviously, if it's a small municipal area, then there can be people moving across. But certainly it does send out a clear message, even if there is some spillage. I mean, we know during the other lockdowns there were certain restaurants that were selling out the back door and people were home brewing, but we did see a big effect. So, yeah, I think it sends out a message, and it's just a little bit less easy to do. So, I don't think the economy, as we all know, can really take a hard lockdown, and we have to look at a more nuanced approach. I mean, obviously there are other things we should be doing, like looking at marketing around special promotions over Christmas. I think there's a whole lot of things that we should just sort of calm things down around about drinking. And as happening in the Western Cape, we heard the Premier here today talk about the need for policing and liquor inspectors to do their jobs, because I think that plays a huge role in going after those places that are problematic. Obviously, our testing and tracing, I don't think it's at the level it should necessarily be, so we can identify where the hotspots are or what kind of facilities are hotspots, and then tailor responses to those. But I certainly think we need to look at a more nuanced approach. The curfew will help because that gets people home sooner, so they're not spending as long in drinking establishments. And we know that, as many people, when they drink a lot, they drink heavily, they drink to intoxication. So if we cut down the amount of time they're spending in the establishments, it will have an effect.
Look, we've spoken a lot over the months about how the ban on alcohol just gave the hospitals a real break. Now we've got the festive season, we'll have people driving long distances, we'll have drunk drivers, we'll have people getting drunk and abusing those around them, sadly. And we've got COVID-19. What advice have you given government on the best way forward now?
Yeah, a multi-pronged approach. Obviously, we were saying this should happen way back when they lifted the second alcohol sales ban. But I mean, there's legislation we should be getting our house in order. The 2017 Liquor Amendment Bill, which has just been sitting there, nothing happening for 3 years. We should sort that out. We need to look, as you talk about drink driving, there's just a portion of the trauma cases that come from drink driving, drunk pedestrians, and we need to make sure there's better enforcement on our roads. As I talked about the marketing restrictions, we need, the idea of probably closing liquor outlets a bit early we've got 3 holiday periods coming up, the 16th of December, over Christmas and New Year. Perhaps over a couple of days over each of those periods, we should be looking at, say, let's close down our on-consumption establishments at 10 o'clock at night or even earlier. And it just sends the message out that we're not at a normal times. Obviously, it's things that people need to do to not have large gatherings, particularly with people they haven't been with. Industry needs to be responsible, closing outlets when they need to close, and they need to make sure there's proper ventilation and that the spacing requirements are adhered to, not filling up just to make profits. It's rather have a focus on the long term, keeping industry going, rather than short-term profits, and then we have a very hard lockdown later on.
All brilliant suggestions, and I suppose it boils down to discipline and as you say, seeing the long term picture, and I think it does also boil down to monitoring, and hopefully we'll hear more about that this evening from the President at 8 o'clock. That, of course, was Professor Charles Parry, the Director of the Alcohol, Tobacco and Other Drug Research Unit.